Happy Friday, everybody. It is James Marin, integrative registered dietitian, environmental nutritionist, and I'm joined with
Joseph Bartolone, registered dietitian, specialist in gut health and eating disorders.
awesome. So, yeah, guys, this is a special live this Friday. You'll notice I'm by myself. Usually Dahlia's with me, but we're going to not necessarily solo. We're joined by Joseph, who's a wonderful registered dietitian at Married to Health. And guys, if you want to learn more about Joseph, there's a link down below, so you can click it now. You can click it at the end of this video, but definitely click it to learn more about Joseph and all the great specialties he has. And you're going to learn more throughout this video because we're really diving into a wonderful topic here. As you know, spoiler alert, the gut, and we've been saying this for a long time, the gut is connected to pretty much everything. We call it the nexus of health, right? Meaning everything is going to pinpoint and flow through the gut, no matter what it is. And today we're talking about eating disorders. So even disordered eating, your thoughts on food, and just struggles you're having with different outlooks and perspectives and the way you're eating and how that is affecting and connected to your gut and that gut brain connection. So there's a lot of connections here. We're going to get into it, but Joseph, tell us for those that don't know, for those that maybe haven't followed us or know about the practice or aren't one of your patients, like, give us a little bit about yourself. How did you even get here into this topic and really kind of diving in to like the gut brain and gut eating disorder connection?
Yeah, so it's been quite a journey. Basically, I would say it started first of all when I was in college, going to school to become a dietitian. Um, I had some health problems before that, but
Mhm.
during college was when I had a lot of digestive issues, and it affected a lot of other things like it usually does. I got a lot more headaches. I got sick a lot more often. So that was like the first time I was aware of like these health issues and that they
Mhm.
affected like my daily, activities.
Mhm.
Um, so while I was in college, I did a lot of studying about like the gut and how it's connected to the rest of the body.
Mhm.
I was very interested in how it was connected with the brain
Mhm.
because I would mostly get headaches when I had digestive issues.
Mhm.
So I started looking into all of the disorders that have to do with the gut and the brain,
Mhm.
and then, yeah, that just got me more interested in that area. I found out about, the link between gut disorders and autism,
Mhm.
Parkinson's, um, autoimmune diseases, just, all sorts of different diseases that have to do with the brain and the nervous system.
Yeah.
Um, and their relationship to gut and gut health.
Yeah. Love it, man. So yeah, it was well, I mean, it's and that's always like we always say struggle and even things we think are like bad can be good. Like they are a blessing, and that's what we believe. I mean, that's something Dahlia and I always say, where from your own struggle, you're learning and you're digging deeper. You're not, and the status quo is like, oh, how many times do we hear like, oh, you're just gonna take this medication for the rest of your life, or you're stuck this way for the rest of your life. And Dahlia shares that similar story. Even I do, but not to like yours, and I think Dahlia's extent, because Dahlia also had severe gut issues and did the elimination diets and didn't know what to eat. And from an outsider looking in, it could almost look like, oh, you're orthorexic or you're having what is it, like frivolous food fears, or what are
Mhm.
you doing? What are you eating on top of, like, we are 100% plant-based. So there's a majority of people out there who already look at us going like, you guys don't eat animals and then you're doing an elimination diet, you're crazy. But with that knowledge and really having that passion, because it's like you're going through it, you take that deep dive and you make those changes, and that's really cool. So then, yeah, and some of the links you said there, like autoimmune disease and autism, and how did you land on like eating disorders, or like what's been your background on that?
Yeah, so that kind of happened during my internship, which is right
Mhm.
after college. To become a dietitian, all dietitians that go to school for nutrition have to
Mhm.
do like a 1 year internship, and we do it at different fields. So basically, um, after college, I really, I was actually excited, even though I was like I wasn't very healthy because like I was struggling with a lot of those digestive issues, but I had like a strong passion,
Mhm.
and I was kind of worried about that when I was graduating, like not knowing what to do. And
Mhm.
then during the internship, I kind of like I was in a few different fields, and I was like, this is okay, but like I wasn't really passionate about anything.
Right.
Um, and then yeah, it was kind of crazy how it happened because I had a week off in my internship where
Mhm.
it was the place I was supposed to go was on spring break. I was supposed to go to college.
Mhm.
So she asked me like, "Hey, is there any other area you would like to try?" And like, no guarantee, but we'll see. We'll reach out to them and see if you could go. And then I said eating disorders.
Yeah.
So I went there for a week, and it was just like I connected with the patients a lot. I saw a lot of similarities in like struggles that I had myself,
Mm.
um, with the digestive issues, and also with the food allergies as a kid.
Mm.
That was one thing that I really connected on. Because they had, a lot of the patients have an extreme fear of foods.
Mhm.
So it was when I heard them talking about foods, it was just like I was like, yeah, I totally get that. Like, yeah, I totally. Um, but yeah, so basically, I related to them a lot, because I understood their fear, and
Mm.
I kind of understood, like, like the orthorexia when I was growing
Mhm.
up. Like I wouldn't eat out. I pretty much made all my own food because
Mhm.
I was allergic to a lot of food, so I was scared that if I went out or if I ate something or ordered out that I would get, a food allergy. Um,
Mhm.
so I mean, it led to me eating like a lot of plain foods, and like, um, that was something that when I went to the eating disorders clinic, that patients would do a lot of similar things that I did
Mhm.
when I had food allergies, but they were doing it for different reasons, right? Like
Right.
the fear of weight gain or body image struggles, or a lot of times a lot of the struggles would tie back to like childhood and trauma, and like
Mm.
just a small comment someone made, and like um, there for me it was about food allergies. For them, it was maybe about like my parents made comments about me gaining weight, so I thought if I gained weight my parents wouldn't love me.
Mm.
And and that was another thing too. I kind of, because I always felt weird having food allergies, and
Mhm.
like I always wanted to be accepted, like
Mhm.
when people could just go out and just eat food, like carefree.
Mhm.
So yeah, it was very surprising when I went there because I didn't know what to expect.
Mhm.
uh, and yeah, I just found a lot of like similarities in the way that I, had to deal with food allergies, other health issues, and like digestive issues,
Mhm.
and kind of the way their mentality was for different reasons.
Man, and that was so much. I mean, like that's so great. I mean, there's so much that overlaps, and that's where you do go into because, like, I don't realize an eating disorder, right? I rarely, every now and then, I get an eating disorder patient, but I'm like, oh, go see Joseph, right? We're always like, all right, or Dahlia gets one, we're like, okay, go see Joseph, but we do get the patients with food fears, right? We do get the patients who because like you said, like your why was the food allergies or food intolerances, and that then brought on the fear, and that then brought on maybe an outside perception of like the orthorexia, like we have this just overwhelming. You're very meticulous with what you're eating, and it's very abnormal to those
Mhm.
around you. Where someone who's at a Thai restaurant who's just like, yeah, give me the pad Thai and give me this and that, and
Yeah.
meanwhile you're like, hey guys, going out in a group and bringing your Tupperware or something. Not
Mhm.
not saying you did that, but we have
Uh,
patients like that, or maybe you I think you did probably do that, right? And so because it gets into all that trauma, right? Of like food is very social. Food is this fun, happy, like we eat when someone's birthday, we eat, for Thanksgiving and all these things that are associated with food. And when you're kind of left out of that, it can then bring you back into, oh my gosh, this reminds me of the time in fifth grade when I was left out of this and that, or like all this emotional trauma.
yeah.
And then it goes full circle to where maybe you've been highly restrictive for whatever reason, and now
Mhm.
you're experiencing a dysbiosis in the gut,
Mhm.
and you're lacking certain short chain fatty acids, or your vast majority of neurotransmitters are made in the gut. So then it amplifies all those feelings, and you're in this just vicious cycle,
Mhm.
right? And that's why it's so cool. Like, it's very few dietitians and even health professionals who kind of merge that. Like, okay, there's the gut, and there's which is your second brain, and then there's your primary brain we all know about. And
Mhm.
how does that overlap? Let's look at this big picture. Let's
Yeah.
take this big snapshot and make sure we're covering as many bases as possible, because there's so much to touch on, right? I mean, it's yeah, that is so cool, man. Uh,
Yeah, and, to that point, I kind of always have this question where it's like, what came first, the chicken or the egg? Like, what came first, the dysbiosis or the eating disorder? Where, like you mentioned, it becomes this cycle where a huge part of it is mental health,
mhm,
but a huge part of it also is physical, where the gut microbiome does change
mhm.
due to eating disorder behaviors, or
Mhm.
sometimes even something that, was unexpected, like an infection or something, right? Like stressors,
Mm,
different things could change the gut microbiome.
mhm,
Um, but yeah, there's always there's always that question, like, which came first? Like, did did someone get dysbiosis, and like you said, it changes the neurotransmitters? Maybe it led to depression or anxiety, and then um, that kind of prevented them from dealing with stress in a way that wasn't detrimental to their health. So then
mhm.
the eating disorder became the way that they were able to cope with stress, right?
Right. And correct me if I'm wrong, like, it becomes what popped into my head when you were saying that is, like, this idea of control, right?
Mhm.
Because things can get so out of control so quickly, and we've seen this time and time again, like, even just on the topic of, like, elimination diets, right? You go like, "Oh, I'm gonna do this elimination diet for, like, a month," and then it turns into 3 months, and 6 months, and a year, and you're like and you have no idea what you're doing, and you're taking 20 supplements, and then you start spiraling, right? And you start losing control, and then maybe you fixate on, well, what's one thing I can control? I'm in control of my food. So whether that is like purging, or whether that's like eating to excess and purging, or just not eating and just really, it goes back to control. Is that, and I'm not an expert in this, but that's what I've found with some of my patients. But
Mhm.
I don't know if
Yeah, yeah, 100%. The control aspect, maybe some patients don't have it, but I've never seen it before.
Mhm,
It's definitely a huge piece of um, getting treatment and working towards recovering from an eating disorder, letting go of that control.
yeah, right.
There's always, like, we kind of say, if you leave the door cracked open at all, like, the eating disorders don't come back in.
Mm,
Like, we have to, like, pretty much wipe the slate clean. Like,
mm,
you have to be willing to let go of that control,
mm.
if you don't want the eating disorder behaviors and everything to return.
And also, just to add context, like, we are dietitians. Like,
Mhm,
usually with eating disorder patients, you are in a care team, right? You're still
mhm,
having your primary doctor, you're having your therapist,
mhm,
a psychiatrist even, and multiple members of the care team. And this is where, a dietitian comes in to just kind of, yeah, help you relinquish that control a little bit and know like, hey, I got your back. Like I'm understanding you, I'm understanding your microbiota, I'm understanding all these pathways and dynamic and the dynamic nature of all this, and I got your
Yeah.
back. So like focus on you, focus on the other members of the care team, and know that, hey, I'm going to give you this nutrition, I'm going to make sure the nutrition nurtures your gut, so then it's nurturing your brain. And that's kind of the sense. So I don't, yeah, I just wanted to preface or give that context and not be like, yeah, Joseph's going to be your therapist, he's going to be your doctor,
Yeah.
he's going to be it all. Like, no, it's a care team for sure. And then also, since I'm at it, anyone watching, the benefit of live, feel free to ask a question, put a comment if this resonates with you, or if you're watching this later, comment down below. We really love to interact with our community. But yeah, and shout out to the Good Gut members who are watching and everything. But yeah, I love this, and I love when it's live because I love to see comments coming in, things like that. But no worries if it's afterwards as well. So, but yeah, so with that care team, I mean, and I know you've been connecting with other therapists and seeing how that like just plays in and everything. But going back to the connection, because the idea here is like, okay, well, what can we, not so much what can we do, but I like to also go like into the why, right? And you mentioned like
Mhm.
what came first, like is it the dysbiosis, or is it the anxiety and this overwhelming feeling of losing control, which then maybe morphs into an eating disorder of some sort? And there's so many reasons for this, right? Like we've explored this and we've been talking about this a long time, and it seems like, I want to say it seems like more and more people are talking about the gut. I want to say it is. I mean, we can also be in a bubble, I know, of like the health
Mhm.
bubble where we just hear it a lot. But I was on like a pod, or I was listening to a podcast, and these guys who are not in the health sphere at all, they were talking about the gut and how it affects your mood and your mind and everything. I'm like, wow, this is really cool. Like people are getting this. But and I know you mentioned some of the whys earlier. So I mean, if I mean, we can kind of go through a list of like, I mean, antibiotic use, right? And I think
Mhm.
something a lot of people don't realize is a lot of times it can be like debt. I gave this analogy, I think, in a blog we were writing, but the idea of debt, right? You don't just all of a sudden one day wake up and you're like bankrupt, right? Or like you
Mhm.
have this massive avalanche of debt one day. I mean, sure, it could happen. I guess there's some scenarios where that can happen. But overall, it's been like this slow accumulation of debt, right? And in the same way with gut health, like it's this slow kind of picking at your gut where it's like, mom didn't breastfed me. I was a C-section baby. I wasn't breastfed. And maybe abusive home, and so you have that emotional trauma and stress, and somewhere along the line maybe it morphs into an eating disorder along with that. But yeah, I don't know if I mean, then there's a ton of other things I missed there, right, as
Yeah.
to the why. But what do you feel about like the why? And when you're talking to patients, Joseph, do you feel like a lot of patients want to know the why, or how do you feel about that?
Um, Most of them do,
Yeah.
but there's a part of it is um the since the eating disorder has become a way for them to cope with stressors,
Hmm.
the why introducing a new stressor can get taken advantage of
Mm,
from the eating disorder voice or eating disorder thoughts.
mm,
Um, and that's why we like to separate them and have the patients practice being aware of that.
mm,
Uh, so, yeah, like if the why comes up, it's all, I mean, it usually like 90% of the times it does.
mhm,
Um, there are patients that are resistant to the why and knowing it and working on it.
right.
And from what I've seen, they have less of a chance of getting better.
Mm,
Uh, but yeah, so once the why comes up in the patients, um, it's the reason why there are like there's different levels of care, right?
mhm,
Uh, through Married to Health, right,
mhm,
and working with you guys, I see patients at outpatient level of care.
right.
So that would be basically, they book a 1 hour session for like one time, one time a week or every 2 weeks, every 3 weeks based on the support they need. Uh,
Right.
but there's also a lot more support for this reason. Um, the reason being that when we go into the why, a lot of times it
Mhm.
will bring out a strong resistance from the eating disorder because
Mm.
that's how they've learned to cope. That's how, right? Um,
Yeah.
they've just learned like, restricting or purging or overexercising. They've learned that as a useful way to cope, right?
Mhm.
It just
Yeah.
got out of hand and kind of turned into its own thing, right? The eating disorder.
Jeez, yeah, and I can totally relate because it is just a form. And I think it's almost like pick a card, right? Of like, how do you want to cope with something? And maybe some of the cards are healthy ways to cope. Like I'm gonna go for a run, or I'm gonna go, walk my dog or something.
Yeah.
And other ways, like I'm gonna restrict my food, or and you just pick these things, and then they just start to snowball, right? So yeah, so with that, would you say so then that kind of part goes more to, like, the therapy aspect of it? Is that would you say
Um,
that or not necessarily?
yes. Yeah, the therapy aspect is huge,
Mhm,
but there comes a point, like in sessions, where if there's a roadblock and they're
mhm,
not willing to talk about food because there's something that's just so strong that we can't get past, it has to be addressed.
right,
So there is a fine line, and I will always like suggest to them, okay, these are the things we talked about, right?
mhm,
Finding coping skills and like working through this. I want you to bring this up to your therapist and come
mhm,
up with goals for that, right?
yeah,
And yeah, I'll always encourage them because just like any field, like dietitians, there's good dietitians and there's bad dietitians. There's good therapists, there's bad therapists.
right,
So I encourage them to bring that up to the therapist,
mhm,
because I just don't know if the therapist is just gonna let them talk, right? Or if they're gonna actually like prompt them on these things as well.
yeah,
And most, for most of the time, like the people in this field, like they're great and they do these things.
mhm,
Um, but yeah, so the it's kind of sometimes it's difficult to like walk that line.
mhm,
Um, and it most of the time it's if it's something that has to be addressed, I'll address it and then say, okay, this would be a great thing to talk with your therapist about as well. And then at the end of the session, like when we're going over the goals, I'll remind them, okay, do you
mhm,
remember what you're gonna bring up to your therapist?
mhm.
And then yeah.
Yeah. Yeah, definitely that summary aspect at the end, and that's what's really cool. I mean, as far as Married to Health is concerned, like we give you that summary. It's in your
Mhm.
portal. You can access it. You have your handouts, and you can revisit it anytime you need to look back and refresh. And it's right there
Yeah.
on your phone or tablet or computer. So it's like that is so key. I can't tell you. It's almost. I don't know if this is for you when you're seeing a patient, but it's almost like a sigh of relief because I'll see sometimes they're like feverishly taking notes and instead of just kind of being present. And I'm like, hey, I'm also taking notes. And definitely I don't want to say you shouldn't take notes, but I'm gonna give you like the highlights and I'll
Yeah.
definitely give you everything I'm talking about at the end of the visit. You'll have that summary and you can access it anytime. It's not going away. And they're like, oh, it's almost like a visible, like, oh, cool. And they'll maybe scribble a little bit, but so powerful. Just kind of, hey, do you remember this? And here's a summary and a
Mhm.
highlight. Now, do you remember what you're gonna say or what you're gonna do? And they're like, oh yeah, and it's a great like check in on top of everything. We do have a question coming in. Um, Let me pop it up. So let's see. We have would you say it's a personality trait as to the reason why someone copes with a specific need? For example, those with eating disorders and using over exercising to cope with the eating disorder. And feel free to answer this the best you can. I know this is
Yeah.
almost getting more into like
Yeah.
the psychotherapy, but yeah.
Well, I so first off, the personality trait,
Mhm.
one like a lot of similarities I see amongst patients is they're very like they have great like they always have well-intentioned, very
Mm.
caring, kind people, very intelligent,
Mm.
and they have a strong drive. So like kind of like that A type personality,
Yeah.
um, that's very common. And
Almost like going back to that control
yeah.
aspect, right? Yeah, but
Mhm.
cool.
Yeah, and it's, I don't let me see. So I've thought about this a lot because a
Mhm.
lot like when I see someone with an eating disorder, they don't seem that much different to me than a lot of people that I interact with, a lot of
Yeah.
dietitians, a lot of people I went to college with in the nutrition field.
Yeah.
The one thing that was different was the way they chose to cope with it.
Mm.
Um, so I don't know, like, could this have happened to me with food allergies? Possibly, right? Like,
Mm.
I relate to my patients a lot. Um,
Mm.
so there is a genetic kind of factor in it as well, but a lot of times a simple thing like a patient in high school having to track their BMI,
Mhm.
that gets brought to their awareness and they notice their BMI is not in the, normal range, and that's what sparks their eating disorder. I bring that
Mm.
one up because I've seen it multiple times.
Yep.
Um, but yeah, it I'd say, like, there's a lot of factors that go into it,
Mhm.
um, and sometimes it might just be, like, the perfect storm of
Right.
having a really difficult time, looking for coping skills, like, not being like, right, like, looking for a coping skill that works for you, right?
Mhm.
And then, having a really difficult time, and then all of a sudden you go to school and they're like, "Hey, you're not normal." And you're like, "Wait, what?" Like,
Yeah.
right? Um, so yeah, there is, there are people that are more at risk for
Mhm.
like using these coping skills and developing eating disorders.
Mhm.
And there's a lot of factors that go into that. Like we were talking about the gut microbiome earlier, right?
Yep.
Um, that's one of the factors that I know a lot about because I've looked into it a lot.
Yeah.
Um, and two, I do, the gut microbiome does influence genetics as well, right? Like
Yep.
epigenetics. So from what I could say, there's tons of factors that go
Yep.
into it, but I'll speak on the one I know the most about,
Mhm.
which is um, there are a lot of similar organisms in the gut microbiome in people that have eating disorders compared to the regular population.
Mm.
And 98% of people that have eating disorders um, have a functional gastrointestinal disorder, which are things like IBS, um, like constipation, gastroparesis, right? Like
Mhm.
digestive issues that, you know, everything looks normal, but the
Right.
patient is having a lot of symptoms and discomfort, right?
And
Uh,
yeah, I wanna touch on that too. For those watching, like, yeah, functional, GI disorder is like everything looks fine. Like you do a
mhm,
EGD, right? So that's the upper endoscopy, or you do a colonoscopy. Whereas let's say an IBD, right, inflammatory bowel disease, it looks like you look like a burn victim from the
mhm,
inside out, right? Like in some cases, in extreme cases of Crohn's, it looks, I mean, you can see the inflammation, you can see the damage being done versus IBS, where, and that's where like the functional comes in, where like, structurally and physically you should be fine,
mhm,
but the unseen, right? The chemical, the neurotransmitter, the hormonal, the microbial level, there's something not right, right? So
mhm,
that is huge. But yeah, I wanted to touch on that. So that's where, and we see that a lot. We have those patients that come in like,
yeah,
they're just so frustrated, they're overwhelmed, it's probably feeding into their anxiety even more, and it's frustrating to have a GI doctor go, "You're fine." And then you're like, "But I'm not."
Yeah,
Right?
yeah.
But I don't know, but continue, I interrupted you there, but yeah.
Yeah, no, thank you for the explanation. Yeah, it's important to know to know those details.
Yeah.
Um, but yeah, you know that those functional gastrointestinal disorders
Mhm,
um and the eating disorder, right?
mhm.
It having a functional gastrointestinal disorder, makes you a lot more um what do you call that? A lot more
Like susceptible?
prone, yeah, or susceptible to getting an eating disorder,
Right.
right?
Yeah.
But what's more in the other direction, patients with eating disorders are a lot more prone to having functional gastrointestinal disorders.
Interesting. So you'd say, yeah, based on the data, it's more in that direction of like,
Yeah, yeah,
and that's what we've seen as well, and, yeah, the data speaks to that. The last time I was looking at the data where it's like, yeah, that is literally one of the root causes if you have a history of eating disorder. And we have some other questions coming in, which this one might be a good one. Can you I'll put it up. Can you discuss, um, how anorexia impacts gut versus bulimia?
mhm,
And I mean, you can take it, but I have a thought because you were saying, I
yeah,
mean, we were talking about root causes, but go ahead if you have an
yeah.
idea of this one.
You could start off. I actually do have
Okay.
a note
Yeah,
on it. I
well, I
want
was
to.
thinking, especially with like bulimia, I mean, or if there's any type of purging going on, right? Where literally you are vomiting way more than your body wants to, right? If that is the case, I mean, we have to think of it like a river going backwards, right? What does that do to an ecosystem? A river is supposed to go in one direction, and the ecosystem is set up for that direction. When you are purging, when you are mechanically forcing your body to evacuate food, whether that is through the anus or through the oral cavity, it is that complete disruption, right? You're talking about stomach acid and different types of bacteria and archaea that are being overly exposed into the esophagus, into the mouth. You're thinking of that acidic destruction. You're thinking of migrating motor complex, right? You're thinking of this beautiful smooth muscle wave that is used to going in one direction, and now it's being told, no, go the other direction. So in the same way you're training, let's say, to work out, and it would be like me, I don't know, just getting a big weight on my left arm and just constantly lifting weights on my left arm, I'm gonna look off balance, right? Like, eventually, my arm's gonna look so freakish that it's gonna mess me up. It can cause me neck problems, the whole gamut. Social problems of like, why is your arm so big? Like, it gets into all that. In the same way, just the simple act of vomiting more will do that to your body. It starts to tell your body to go the opposite way. We find this in SIBO. A big indicator of SIBO is if you've had a past history of eating disorder. So I don't know if you have anything to add to that, but I mean, it's all of the above, and there's even more I probably didn't mention, but yeah.
Yeah, no, definitely. And that explanation is what I give to a lot of my patients that
Yeah.
have bulimia or binge eating disorder with purging, or
Mhm.
even anorexia with purging. Like you've trained your body, like you've trained the stream to flow in the opposite direction.
Mhm.
So it's gonna take a while for you to retrain your body to go
Right.
back down in the normal direction, back out, you know, towards your anus, right? And not
Mhm.
back back up through your mouth, right?
Right.
Yeah, it it affects a lot of things, right? Two,
Yeah.
there's the sphincters that separate, right? The esophagus and the stomach. Like
Mhm.
that is now moving in the opposite direction, or it has been for a lot of right when you're purging. So,
Mhm.
now that is more prone to release stomach acid up into the esophagus.
Mhm.
So most all patients that I've had that purge have reflux or
Yep.
GERD, also known as
Mhm.
GERD.
Yep.
um, Yeah, and I do sorry, so I was looking for this. I have some information on the specific differences with it. Um, and yeah, so in anorexia, there's more gut permeability.
Mm,
Um, there are, uh, hmm, actually, this is not what I was looking for. But yeah, basically, like that explanation you gave on bulimia, right,
uh-huh.
is is the main like the main thing I believe is, you know, causes the gut to be imbalanced and causes issues is just like, hey, everything's trained to go in the opposite direction now. Um,
Mm,
Whereas for anorexia, what I see is a lot of the gut microbiome, the ecosystem, right?
mhm,
There's tons and tons of different species.
mhm.
Those species are reduced a lot, and
Right,
motility is slowed down a lot more.
right.
So motility being, how the gut and, the GI tract pushes
Mhm.
food down so that
Right,
it could be digested, right?
right,
So basically, if the patients with anorexia, they're just not eating,
right.
the gut's like, cool, like we don't have to move, like we're just gonna chill, right? So yeah, basically there's a lot of similarities.
Mhm,
But for bulimia, almost always reflux or GERD. And along with that, like more burping and more like more of a fullness feeling in the esophagus and the chest, which is
mhm,
very uncomfortable for them.
mhm,
And then anorexia, more constipation, more
mm,
issues that come along with motility issues.
mhm,
Um, the immune system is, a lot less effective because
mhm.
you have a lot less organisms in the gut and a lot lower diversity.
Yeah. Yeah, that makes total sense. Yeah, and that's how I was thinking of it too. Like anorexia is this kind of starvation where bulimia, you could still like anorexia eventually gets hard to hide because you look emaciated. Your body is then feeding on itself. I mean, very early on, and then continues to do so. So you look pretty malnourished. Whereas bulimia, I think you could look pretty normal
Mhm.
and people don't look at you and go, "Oh, you have bulimia." It's whereas
Yeah.
someone who's severely anorexic, you're going, "Okay, what's going on here?" Like, again, I don't say this with distaste or anything, but whether it's like, "Oh my gosh, cancer or something's going on," or I mean, they can
Yeah.
look very emaciated. So,
Mhm.
yeah, it is that starvation. You're losing that diversity. Your body again, one of the first things your microbes eat is that mucosal layer in your gut, that protective, nutrient dense. I mean, it is carbohydrate rich. So that's where even a lot of people on a low carb diet, this starts to happen, let alone
Mhm.
someone who's completely, just lacking calories and nutrition intake in general. So yeah, that's really interesting. Also, EOE, right? Eosinophilic esophagitis. We mentioned
Mhm.
autoimmune issues where your gut lining, and this is including the esophagus, gets extra permeable. Now, if you threw acid on something that's not supposed to have acid on it, is it going to get more permeable? Yeah. So that includes your esophagus getting more permeable and increasing the risk of autoimmune disorders because of that permeability where there are nutrients coming down into your esophagus and those little molecules are going into the bloodstream are activating essentially your immune system in that cascade reaction and essentially that inflammation where you're like and you're just always "Ugh, I don't sore
Mhm.
throat or I'm always coughing." It is part of that reflux where EOE can be a bit more persistent and a bit more like a head scratch and annoying and just yeah, give you a lot more than just like, oh, I burped and I'm coughing up acid, right? You get into all the different types of reflux and things that can go wrong. And yeah, it's crazy. So that was an excellent question. We have another. We have another one here. Let's see. Um, would you think people with IBS and other digestive issues with an eating disorder history could benefit if they follow an intuitive eating approach? Interesting. So, and this is something we could continue to touch on, which is the overlap of those we're seeing with IBS and just any digestive issues that overlapping into eating disorders. And then this question, if the benefit from intuitive eating. So, yeah, I'll let you take that, Joseph. I mean, overall, is that your approach? Like, just eat intuitively and it'll help, or yeah,
Well, it's like intuitive eating's a goal, but a lot of times you have to build the foundation first.
right.
So, especially with patients I see at like a higher level of care,
Hmm.
they just have like a lot of times before we go into intuitive eating, they
Hmm.
have to get consistency, regular, like teach their body how to eat regularly, all of these things. Like if I were to tell a patient that comes in that has been restricting for days, like 3 days at a time, and like maybe eating something on the fourth day, I tell them to eat intuitively. They say, okay, my body just tells me not to eat. So right. So, what I see as well with like IBS
Uh-huh.
is your hunger cues, which is what you focus on, your hunger and fullness cues with
Right.
intuitive eating, those could be affected by a lot of different things in IBS.
Yes.
One, like, basics, constipation, bloating. You may be full, but it may be gas. And sometimes, like, if you're full, you're
Mhm.
bloated, but then you eat something, it pushes out the gas, and it actually, right, like, it changes your hunger and fullness cues.
Right.
Um, so intuitive eating is a great idea, and it's something that I think a lot of people would benefit from.
Mhm.
But if you don't have that foundation first, it's very difficult to do.
Mhm.
Uh, and so just to explain intuitive eating a little bit more, uh,
Mhm.
there's 10 principles for intuitive eating.
Mhm.
I'm not gonna name them all off the top of my head, but, uh, but yeah, there's a dietitian and a therapist wrote this book on intuitive eating, and I mean, it's a great book called Intuitive Eating. They outline 10 principles in there
Mhm.
that you follow to basically pay attention to when you're hungry, pay attention to when you're full, like,
Mhm.
practice awareness around meals, practice mindful meals, um, and just, to make it simple, eat when you're hungry, stop
Right.
when you're full, right?
Right.
Uh, yeah.
I
So yes, I would say a lot of the same difficulties in following that with IBS
Mhm.
um, could be that your hunger and fullness cues are affected by a lot of IBS symptoms as well.
And I agree with that. Yeah, and it's yeah, I think that's a goal. Like intuitive eating is a goal, but when it's context matters, right? And there's a lot of good with intuitive eating, but then there's a lot of important context. Again, the
Mhm.
context matters. Like where someone who is intuitively eating, it's even like what is food, right? Someone's definition of food can be different. Like I know my definition of food is different from some of my family members' definition of food, right? I don't see Ruffles, not to call out brands or anything, but like or like these potato chips or even like I think Pringles is a good example where it's like this starchy like concoction
Mhm.
that's smashed into these weird shapes, or like I grew up eating Pop Tarts and Gushers, and I guess technically that's food, right? But is it really? It's more of, to quote Michael Pollan, like a food-like substance. And these are highly palatable, excito, and even I forgot which doctor was coined the term like excitotoxin, where it's very palatable, right? You're getting that bliss point. These companies know what they're doing to then play on, and heaven forbid you have someone who's undergoing an eating disorder, dysbiosis, IBS, SIBO, and then you're eating this highly palatable, highly refined food that then is like throwing gasoline on the fire that's already going on. And you're like, whoa. And it's like, yeah, just eat mindfully. I'll have a handful of gushers or something, right? It's like, no. So that context matters. And even in the context of, yeah, going back to your medical history, your health, do you have IBS? Have you been working with a care team properly diagnosed with IBS or SIBO? Which again, not all IBS is SIBO, but all SIBO is IBS, right? So if you have SIBO, you do have IBS, and then is that messing with your ghrelin and leptin, like we're saying, these
Mhm.
signals and this communication network to telling you I'm hungry or I'm satisfied. So
Yeah.
because you're in the place you're in, you're not getting those proper signals. So then it's hard to then intuitively listen to your body. So yeah, the list can go on and on. I mean, the context matters to this, right? So typically it is kind of assessing, and this is for me, this is really not for eating disorder, but more like SIBO IBS. It's like,
Yeah.
where are you? What is going on? What type of SIBO do you have in the first place? How can we get you back to a normal communication pathway in this SIBO, and get to the root and understand the why, and then get you to a better place? You're not digging in this hole. Um, and then you're so deep in that hole, you can't see the light, you can't hear any noise, and that's where you can't be intuitive. Let's get you out of that hole a little bit, so now you can see the light, you can hear the sounds, now you know what's going on, and you can understand your body a little bit better and kind of build from there. And then throw into the mix of then, definitely, well, with that is adding more foods, and maybe there's supplements that can help. Maybe there's medications that can help to
Mhm.
get you out of that hole, and then continuing to build on that progress. I know with eating disorder can be, that's like a whole nother monkey wrench into that plan, right? Where then your mind is playing tricks on you. Your fear starts to consume and overwhelm, and um, even, and this goes back to where I think back to this, even our ideas of like, I shouldn't do a single fart in a day, right? Like, I should never have gas and bloating. Like, no, that's not true. Like,
Mhm.
you can pass gas, right? Like, we
Yeah.
say farts are friends, but if it's excessive, if it's sulfur smelling, if you're having abdominal pain, and all that context matters, right? You have a history of constipation and you're excessively gassy, yeah, that's something we can look into. That context matters. So yeah, very interesting. So I think overall, from what I'm hearing from you, and then even my perspective is like, yeah, intuitive eating has its place, but with the right context, right?
Yeah, and two, I just want to touch on too, like what you brought up. So
Hmm.
all of the foods that we were talking about, or that you were talking about, we right with eating disorders, we call them fun foods. Um,
Mm.
a lot like how does someone take that, right? Sometimes it's like, oh, these are fun foods, I could eat these whenever I want.
Yeah.
Like,
Yeah.
hey, we made a meal plan for you. It's a balanced meal plan,
Hmm.
right? And it's to meet all of your energy needs. So
Right.
we made that for you. You're allowed to include these fun foods, right? But
Mhm.
we also want to practice balance.
Yeah.
So that's just another reason why like it's hard to eat intuitively,
Mm.
because the if foods are taken off the table for
Mhm.
someone, especially people with binge eating disorder,
Mhm.
then those are the foods that they binge on, right? Like, if like, right, because coming back to that control aspect, hey,
Mhm.
you can't have gushers. They go buy the whole box of gushers and they eat, right? Like,
Right.
so it is right. Like, there's a reason why it's not like your meal plan is for breakfast. You're having 3 packs of gushers and a fruit, like,
Yeah.
right? Like that's not your meal plan.
Yeah.
But to work through it, sometimes like that balance between the stress and control aspect of it, and
Mhm.
then the like what do they actually do when they
Right.
when they have this information, right? um is something that affects that as well, right?
Yeah.
Like,
Yeah.
you know, that with the intuitive eating and saying for someone who's like, hey, I binge on, whatever Doritos, or like I'll buy a whole like big bag and I'll eat the whole thing. Um, then it's like, okay, um, don't eat Doritos, right? And then
Mm.
they come back the next week, they're like, "Hey, I bought 2 big bags of Doritos," and right? And,
Yeah.
so yeah, so it is, it's that's part of that, like, um, based on, the individual approach.
Right.
Where is this person at?
Mhm.
If, what level of readiness are they at? Um, are they ready to start they just started eating consistent meals again?
Mhm.
Are they ready now to start focusing on like 100 different details on on foods and like think about everything when they're about to eat? No, like it'll take a while for that.
And that's so funny you said that because I was just thinking, like, that's why I don't work with eating disorder patients because I am that person of like,
Yeah,
all right, well, I again, this goes back to like our training and our experience where again, I don't overwhelm my patients or and Dahlia doesn't, or I don't think any of us do. Really, like, I think the most I get is maybe like 6 goals from a session, and that's really meeting the patient where they are. But really, I try to keep it to like 2 or 3 so that they can really focus and hone in. But yeah, I would be the guy that's like, "Oh yeah, we're gonna pesticide residues and then like, oh, artificial colors, be careful with that." And
yeah,
I would drive a eating disorder patient crazy where they're like, "Oh my gosh." But on that note, because you mentioned Doritos, right? Where we know Doritos are hyper palatable. We know even Doritos contain MSG, which
yeah,
in the right setting with MSG is something we feed to laboratory mammals to help them eat more in certain feeding studies on animal-based studies. So like, look, there's a reason why MSG tastes so good, right? And it gives that
mhm,
umami, that excited flavor to our senses in the
yeah,
oral palate, which then go up to our brain and say, eat more, eat more. This is great. This is making me feel good. You get that endorphin boom, and that whole
yeah.
cascade happens. Do you ever address that with eating disorder patients, or is that, like, down the road, or you do just not.
Um, I don't lie to my patients. Like,
Yeah.
I know there is, there based on a dietitian's style, they
Mm,
address it in different ways, but, I'll tell them, like, if they're like, "Oh, like, Doritos, like, have MSG in it," I'll just be like, "Yeah, you're right." So, like, right? And it
yeah.
and then, right, when we go to the, like, outcome side, it's like, "Oh, well, what happens when you think about that, right?" And it's
Mhm.
like, I want to eat more Doritos, right? So it's like, how do we work through that, right?
Right.
It depends on the individual. But yeah, a lot of times, like, um, one thing that we will do that, like, patients, like, when they hear it, they're like, "What? Like, what are you talking about?" Is like, patients that constantly binge, we do a plan binge and I do it with them, right?
Mm,
So it's like
mhm.
removing that fear away from it a lot of times.
And that stigma almost, right,
Yeah,
would you say?
yeah, it's like the like, on like a cartoon when they leave a kid in the room and they're like, "Hey, don't touch this red button. I'll be right back."
Yeah.
You know, they always touch the red button. So that control aspect where it's like, "Oh, you know what? You're right. MSG is in Doritos. Don't have anything with MSG." Then it's like, "Okay, so I've been eating chicken and rice only for the past like month now."
Yeah.
Like, and that's a thing too, is like, I understand why telling them this sounds like a bit like throws them off, right?
Mhm,
And two, as a dietitian coming into working with people with eating disorders,
mhm.
like, I had to see it for myself.
Yeah.
These things that these techniques, like, I only learned them after I messed up. I only learned them
Mhm.
after I saw different outcomes, what was helpful and what wasn't helpful. like, one time I said, like, when we were like picking out snacks, someone was getting popcorn, and I was like, "Oh," they're like, "Hey, how much is a serving an exchange?" And I was like, "Oh, that's more than I thought." And complete breakdown. I'm never eating popcorn again. I
Oh,
so it's
man.
yeah, it's just those details. A lot of it's just from experiencing, seeing what works, seeing what doesn't.
Mhm.
Um, but me personally, like, I don't lie to my patients. I let them choose. I tell them, "Yeah, these foods do have MSG. Like, you wanna try to cut out all foods with MSG and see what happens? Like,
Right.
be my guest, right?" And most of the time, they'll be like, "You know what? Like, I already have I'm already cutting out a bunch of foods. Like,
Mhm.
I don't think that'll be helpful."
Do you on that, I mean, do you ever do swaps too? Like, because I know we're big on organic. Like there's still studies coming out with like organic in the gut, but
Yeah.
there's a lot of great studies on soil microbes, and then there's the indirect link of like, okay, well, we know pesticides that are used more in conventional crops and things like that negatively affect the soil health, and then we get about a large percentage. Last time I was looking at a study, it was like 75 plus percent
Mhm.
of the soil microbes mirror the microbes in our gut, and we're getting a vast majority of our microbes from the environment. Even just breathing, we breathe in something like 10 fungal spores with every inhale. So imagine how many inhales you're doing a day, and it starts to seed your lungs and et cetera, right? So it's like, okay, is it if someone's saying if you're doing a planned binge and there's an organic Dorito versus a
Yeah.
are you doing that as well? Or like how do you feel about that?
Um No, like it's pretty much
Mm,
like they choose. They tell me what
mm.
they're so if they would say like, "Hey, I binge on organic Doritos," then I would say, "Hey, okay, we're bringing organic Doritos in, right?" Like, but if I were to change it, then they would, they would eat that, be fine, and then
Mm,
they were like, "Hey, I had the organic Doritos in session, and I felt fine. But then, those like I was still thinking about those like regular, right? And I do, and it depends where they're at because
mhm,
I do also talk to them about like picking quality of food, like
mhm,
right, like a big, and that's going back to the intuitive eating. The
mhm.
last principle is, oh man, gentle nutrition.
Oh, I love
uh,
it.
so it's basically like, um, like, hey, like, yeah, vegetables, fruit, fiber, like that's
Mhm,
important for you too.
mhm,
So, it's not saying like choose the Doritos over like a piece of fruit. It's saying like, like part of intuitive eating is you want to feel good after you eat. And
mhm.
if you eat like 5 packs of Gushers for breakfast, you probably don't. I don't know if there's people that feel good after that, like, but most people probably probably wouldn't, right? Um,
The
but
8-year-old inside of me would feel good, but the person I
yeah,
am today would not.
yeah. Yeah. So
Yeah,
yeah, like it is there's a lot a lot of areas to navigate within it, and
yeah.
it can be difficult with those. Uh but the like the gentle nutrition part, and that like once they've worked through their fear foods and all of that, like it's
Mhm,
kind of like that foundation
mhm,
where someone who is not eating anything for like a week straight, and they're at like critical, um like their stat health status is very critical,
yeah,
and all they want to eat is like gushers, then like, okay, nothing or gushers, like it, or like where they're at, right? um that's it I've never seen that before. Like we make them a meal plan that's balanced, right?
yeah,
And then the ultimate goal is working towards intuitive eating, working towards gentle nutrition. It's
Mhm.
just, they make that choice.
Mhm.
So if they're making the choice to start eating again,
Mhm.
um, and we try to put control on that, then
Mhm.
they will come right back and say, "Fine, not gonna eat anything."
Right, yeah.
Yeah,
Yeah, no, I love that. I mean, it is. It's
yeah,
as any health professional, you're meeting your patient where they are, and I ultimately we've used this analogy a lot too of like everyone's climbing their own health Mount Everest, right? Whether you have anorexia, or whether you have lupus, or whether you have Crohn's, or you're just even trying to just, hey, I want to have a baby soon, and I just want to make sure I'm super healthy. Like that, that is your own health mountain.
yeah,
It's about finding those health professionals like the Sherpas, right? Your guides that can see and have been through as many of the paths as possible on that mountain, right? You can pick
yeah,
a guide who only knows one path and okay, you're going to be limited. You're going to go down that path. Or you can pick the guide that has been doing this a long time and knows the 30 paths that there are to this mountain and look at you and look at your gear and look at where you are. Okay, we're going to start on this path and then we'll eventually switch over to this other path. And really that's what it comes down to, right?
mm,
That's like the meeting patients are there. That's why we are an integrative practice to look at all these root causes and pathways and go, okay, this is a good path. Well, I love it, man. I think, and on that note, it is the summary of this is there is a gut eating disorder connection. Your gut is powerful, but also, you as a patient or anyone watching this suffering with the eating disorder, you have the power to not only choose your care team and choose someone who kind of looks at this big picture and can see the pathways, but also you're leading. You're ultimately going to be do the walking on that path. You're ultimately going to be doing the climbing up that mountain.
mm,
And I commend anyone who is suffering with this, watching this is a step in that direction. Maybe you are seeing a therapist or a dietitian as a step in that direction. If you want to learn more about Joseph, you can click below. You can go to marytalk.com and learn more about working with Joseph because he is that guide on and is been exploring all these pathways up this mountain to get you to where you want to be and to get you to your goals. So this was great, man. It was wonderful. Any last words or like I don't know, anything at all, whether it's an empowering message or for someone who's like watching this and going, oh man, I don't know if this is disordered eating or I'm not sure. Do you ever give any tips for that?
um, yeah, what you kinda talked about, and, like, everyone
Mhm,
has their own journey, right?
mhm,
The what Why I love working with you, Dahlia, and the rest of our team is we all believe in an integrative approach. We
mhm,
all believe in the root cause, right? Like I've had patients coming in thinking they had an eating disorder, and I'm like, oh, like you actually have some pretty severe SIBO, or like you actually
mhm,
do have some food intolerances or things, like a lot of these, like the disordered eating is actually coming from like maybe a functional gastrointestinal disorder. Um,
mhm.
and then the opposite too, where it's like patient comes in, I think I have SIBO, I think I have, and then it's like, okay, like, I think you have an eating disorder.
Yeah.
um, but yeah, I would say just overall, like the reason why um, you choose to work with a professional is
Mhm.
because a lot of times it's hard to see
Yeah,
what the root cause is
right.
when it's your root cause.
Yeah.
It,
Yeah, you're so in it. You're so, like, up close to it that you
yeah,
can't you need that outsider perspective for sure, or, like, you're so overwhelmed maybe by looking at this mountain and you're just like, "Ah," and then yeah, I or you've never walked up a path before and you have no idea where to start. So,
yeah,
I think that's great, man. Yeah, it is. It is finding your why. It's making sure you have a care team that understands that, and it's so, so vital. But Thank you, Joseph. We so appreciate it, man. I know we could talk forever, so we'll definitely be doing this again. Guys, join us next month. It's usually the first Friday of the month and the third Friday of the month. We are live in some
Yeah.
capacity, either with all of our dietitians or one-on-one, doing our good gut lives, talking about SIBO, IBS, talking about cool things like eating disorder, gut connection, and gut health. Talking about last time with all the dietitians, we talked about kind of anxiety around just being healthy and some of the
Mhm.
fears that even brings and that being overwhelming. So you can go back and watch those videos. Like I said, to learn more about Joseph, you can click below or visit marytouth.com to make an appointment. And Joseph, thank you again, man. And to
Wonderful.
everyone watching, happy Friday. Have a great rest of your weekend. If you're watching this later, comment down below with other topics you want us to talk about. And we'll see you all soon. All right, dude. Talk to you soon. Thanks.
All right. Talk to you soon.
All right. Bye.
Bye.